Hi everyone, it's Dr. Sarah McClay. I am coming to you from home. I have been feeling a bit unwell since Friday, and as a result, I'm running all of my consults from home today by the phone. Now, I thought this was a good opportunity to touch base again and release some more information on COVID. Yes, I know you're all being saturated, but from a doctor's point of view, I think it's important to recognize that the situation is escalating and that doctors like myself are becoming more and more vocal about how important it is that we take this seriously. And I guess I wanted to add to that and give you a little bit more perspective. So bear with me. Now, the total number of cases in Australia has hit a tipping point. There are some really clever minds in the medical community working on this, and one of those minds, Dr. Michael Tam, put this together over the weekend and released it. So on Sunday, we hit 250 confirmed cases of coronavirus in Australia. This seemed to be a bit of a critical point for other countries, and it resulted in a substantial proliferation of cases and subsequent issues managing the workload in those countries. I think it's important for us to recognise this and to identify where this could take us and how quickly it could take us to a very, very, very large number of infections. It's also important to point out that there are limited tests available and that as a result, the government has brought in restrictions around who can be tested and uh, what indications really indicate testing. So pretty quickly, the numbers of infected will actually not represent the true number of cases in the community. So please remember that when you're watching these television broadcasts, that in actual fact, you are looking at the tip of the iceberg and there will be more infection rates than what we are reporting. Just to remind you again, doctors all around the world are really becoming quite vocal, and they're becoming vocal because they want you to understand how serious this is. In Italy, over the last few days, the obituary notices have been 10 pages long in the paper. So 10 pages long, lists and lists and lists of people that have passed away from this virus. This is real, it is killing, and we either crack down now collectively and control the spread, or it spreads and just like Italy, we have people passing when they shouldn't be. This is a real problem. It's a real problem. Yes, I know you've seen this curve everywhere, but it's important. If you don't take this seriously, we have this spike, and there's every chance that if you have a car accident, if someone in your family has a heart attack, there may not be an ICU bed available for them to be treated. So it's not just those with the illness we need to think about. We need to think about those that have accidents and those that have other medical problems that could require hospitalisation and a lack of resources to deal with those issues. There are not enough ICU facilities to support everyone if this virus spreads. We aren't just short ICU beds by a few. The reality is we're short by thousands. And I'm not talking a few thousand, I'm talking hundreds of thousands, like 200,000 plus. You know, the numbers, they've been scrutinised by us medics, and we are worried. We are really worried. Um, the time is now to act. The time is now to protect those in our community that are vulnerable. The reality is there may not be ICU facilities, not just for the vulnerable, but for you or I when we get sick. So just a reminder, there are those that are at risk are those over 70 years of age, anyone in the community who has lots of medical problems. So if you've got someone at home or in your family who takes lots of medications, chances are it's them, even if they're not over 70. People with a low immune system, this might be people on immune suppressant drugs for transplants, people who have had chemotherapy or radiation, or those with immune system problems such as rheumatoid arthritis that take methotrexate or prednisone. Children less than 1 year of age, and pregnant women. Now, this age group and this particular group, we don't really know a lot about them, but we know that their immune system is low, and we are yet to really see what coronavirus is capable of in this group, but we don't want to test it. So we're just going to treat them as though they're high risk. This picture is everywhere, and it's everywhere for a reason. It's really important. This is the key. Social distancing is the key. For those of you that are well, when you're out in public, think about how far you are from other people. Think about that 1.5 meter distancing. Please avoid large gatherings. They are just an absolute culture pot for this sort of infection. This measure is important. This measure has the capacity to significantly reduce infection rates. Wash your hands. Do it properly and do it frequently. There will be guides all over the internet on how to do this. Look them up. Make yourself and your family familiar with it. When you are in public, I would be avoiding hugging, kissing, shaking hands. You don't know who is unwell and who isn't taking it seriously. Even though you might be taking it seriously, those around you, unfortunately, can't be relied on to do the same. So just be thoughtful of this. Be thoughtful about the sorts of contact that you're having in public, uh, and protect yourself. Remember, this is aerosol spread. Coughing is huge. If you're sick, please stay at home. If your kids are sick, please keep them at home. Children are the vector. They are spreading this. They're spreading it without even really showing many symptoms. So please take this seriously. Don't visit your GP. We now have Medicare item numbers in place to help facilitate those phone calls. It's time to use them. Have an action plan. So if you have a member in your family who is vulnerable, think about what you're going to do when someone in your family shows symptoms of a virus. Think about how you're going to protect people that matter to you. And don't just wait for it to happen. Plan ahead. Have some processes in place. I've been meeting with my vulnerable patients face to face, but that will no longer be the case. I'll be discussing these action plans with them over the phone. It's time for you to do the same. Take this seriously, guys. Consider others. There will be fatalities from this virus. Please make 3,000 ICU beds enough. Control the curve, control the spread. We have a small window now to really change the game. If you don't join us in making the effort to protect yourselves and your community, this virus will spread and this virus will kill. So please, like me today, stay at home if you're sick. If you can, work remotely from home. Any measure that you can put in place to protect you and your family will make a difference, and it's time. It's time for all of us to start trying to make a difference and reduce the spread of this virus. Thanks for your time.